my name is Cynthia Peterson. I'm a physical therapist and an orofacial myofunctional therapist. And
I'm Kendra Anderson. I'm a pediatric respiratory therapist.
And we are so excited to tell you about a course that we've worked to create. It's called Baby Jaws Breathing Nose to Toes.
I first met Cynthia as a patient. I was bringing my son to her for treatment because she had the knowledge I did not have. I knew that there was a respiratory component. I didn't know how to get there. And Cynthia had the answers for that. And after seeing her with two of my kids now, Cynthia told me she was working on this wonderful course that was focused on airway. A lot of times that's the missing piece. We see all these wonderful therapies and everything that are applied to other parts of life, which are great, but breathing is so important, and there aren't that many people who are out there addressing breathing. And she said, we need a respiratory therapist on board. We need professionals who are focused on airway first. So she brought me in and we started to educate other people. Cynthia has this wonderful course that I helped collaborate on called Baby Jaws, and it's about breathing from your nose to your toes. It's addressing all parts of breathing, not just one small part. It's looking at the whole big picture to know how to best help these babies breathe. In that course, we focus a lot on the ABCs of early intervention. So that's airway, breathing, craniomandibular growth, and sleep. And really, when you put those first and you address those, it's amazing to see what a difference and impact it has on all these other things that we were struggling with our son, right? So with his brain development, his behavioral issues, his airway, his allergies, his sleeping, his feeding, so many different aspects needed to be treated airway first before we went and found other interventions. And so we were really excited that we had found answers. Cynthia was really excited to have someone who had seen so many babies and their airways and their breathing, and that's when we decided to make this great partnership and collaborate together. And we are so passionate about getting the word out there to all practitioners and parents everywhere that as we take this airway first approach, we can really optimize health for these babies on every level. Babies' airways come first. Once you fix that, then it's amazing to see just how these babies thrive. And a lot of times, not all the time, but a lot of times, those unexplained symptoms that we don't have answers for tend to get resolved.
Basically, we want a foundation. So we want to do the ABCs of early intervention, which are
airway and breathing,
craniomandibular growth and function, as well as sleep. Everyone's focused on tongue ties, and tongue ties are real and can be an important issue. But again, you can live your whole life with a tongue tie, but only minutes without air. So what should be our focus?
Airway, always.
Always.
Yep.
Always. Airway and breathing first. So come see us. We've got some courses for professionals, as well as we're creating some awesome stuff for parents like you.
Yes.
Hey,
Can't wait to have you join us.
All right.